Good morning, everybody. I'm delighted to be here and have the opportunity to show some of the results of our research line focused on the meta-research. First, I'd like to introduce our research briefly. It is known that study methods are frequently not described in detail and that the results are presented incompletely. From a clinician's perspective, this makes very difficult to apply the research findings to the patient. To our knowledge, completeness of reporting and its relationship with the risk of bias in systematic reviews about rehabilitation intervention have not been systematically evaluated. Therefore, our objectives were to assess the completeness of reporting in systematic reviews published in rehabilitation journals through the evaluation of the adherence to the PRISMA checklist. Moreover, we search for a relationship between the reporting and risk of bias, assessing our sample with the ROBIS tool. And lastly, we investigated whether a relationship exists between reporting, the impact factor of the journals, publication modalities, year of publication, and registration of the study protocol. We selected a random sample of 200 systematic reviews published in all journals indexed under the rehabilitation category in Insights. The sample was stratified for publication year and impact factor to make homogeneous our sample for these two variables. What we have found is that the completeness of reporting was suboptimal. The mean overall adherence to the PRISMA checklist across studies was 61.4%, with significant differences across the section of the PRISMA. The finding and methods are sections with the poorest reporting. Regarding the relationship between such completeness of reporting and risk of bias, we found that studies with a high risk of bias have less adherence than those with low risk of bias. In particular, the largest differences were in risk of bias tool domain 1 and 2, both in qualitative and quantitative analysis. Moreover, we found a significant relationship between completeness of reporting and journal quartile and study protocol registration. The lower the quartile, the poorer the completeness of reporting, and the overall adherence increased if the protocol was registered. In conclusion, there is certainly a lot of room for improvement. The completeness of reporting must increase since it is still suboptimal, although we have had reporting guidelines for more than 20 years. High risk of bias is associated with a poorer completeness of reporting, indicating that if a study has bad reporting, this could positively affect the transparency of the risk of bias evaluation. The registration of study protocols and journal ranking is also associated with the more complete reporting. Authors of systematic reviews should improve the adherence to the reporting standards, and journals editors could implement strategies, especially in the peer review process, to optimize the completeness of reporting. Thank you for your attention.